Howdy everyone, Matt here. I got a question for you. Do you think that basic physiology is just forgotten about by physicians? Let's talk about it. All right, everyone. First and foremost, let me introduce myself. My name is Matt. I am Matt the PT, coming at you with another video, another topic of something from the physical therapy world. And this one, it's a little bit of a combination of things, okay? Something I've experienced in my career, and then a friend of mine, posted something about it, and I said, you know what? I want to talk about it because it's something that's driven me nuts, and I really feel that we need to talk about it. And it's that, do you feel that just the basic human physiology is just forgotten about when it comes to rehab, and especially dealing with physicians at times and in terms of rehab? Now, a good friend of mine, Lisa with Home Health Chronicles, made this video right here, and she is highlighting a conversation that she had with a friend of hers who is a therapist. I will share it right here.
So I just want to talk about this text message that I had with my friend who is a PT, and this goes out to all of the orthopedic doctors and the PTs, OTs. Let me know what you think about this if you've had this before. So with this, my friend who is a PT, her mom had a nasty fall. Didn't hit her head, but she ended up getting a hip replacement. So she went out there, worked with her mom. She goes, she's been getting around slowly. I ended up installing 2 raised toilet seat risers, got some walker sliders, taught her how to get in and out of bed using the leg lifter, reviewing her precautions. And this is the kicker. The doc doesn't want PT until after their follow-up in 2 weeks. She got discharged home from the hospital, no referral, 0. Posterior hip replacement, nothing. So this just drives me absolutely banana. It was like, oh, you just need to go home and heal.
So that's a thing. Okay, this person had a fall and a surgery. All right. And like she said, the doc said, don't do anything for 2 weeks. Okay. Don't do anything for 2 weeks until you come back and see me. And there's 2 things I want to kind of really talk about with this, because I think this is just absolutely insane, and it goes against what is actually needed by a patient or somebody who is going through a health issue. And I want to share the first part of it right here.
You know how much people remember after they've gotten a surgery about what you've told them in the hospital? 0 thing. 0. Nothing. It's just like they're on anesthesia. They have no idea what's going on. I have seen people in their home post-op day 0. They got their surgery 8 a.m. in the morning, and I have been in their home at 3 p.m. that same day. I've been there post-op day 1, post-op day 2. And let me tell you, they have no idea what you've told them in the hospital. Yes, you are educating and going over precautions. It's going in one ear and out the other. The other thing is their home setup is not what they tell you. Okay, yeah, sure, a wheelchair can fit, a walker can fit, I have these devices. No, they may have them, they don't know how to use them. So here's the PT, you're coming in, you get home, you have your hip replacement, you're in a lot of pain, you don't know how to get up, you don't know what you should be doing, you don't remember your precautions, you're using a walker you never used before. Oh look, the walker doesn't fit in the bathroom, how am I gonna get in there? Oh look, my toilet is this tall and now I'm breaking my precautions. Oh, I can't get in and out of bed, it hurts too much, what do I do? Now I've got all these new medications, I don't know what to do.
So those are excellent points that she brought up right there. Now, people are probably going to come in here to say, what, getting therapy in there early, that you just want to get the insurance money. You just want to go back and listen to what she said. Think about what is going on with this person. Now, I don't know who this person is. You don't know who this person is. I have never seen them. But this happens so often. And I feel like when people want to argue against it, they're going to pick this like pristine, optimal example. Oh, this is the perfect case here that I'm going to use, which is not what real life is like. But think about what most people will go through after a surgery like that. You had an injury, you had this surgery. You get bombarded with a ton of information there. Okay. You get bombarded with it. You may or may not have somebody with you who is going to understand everything that was told. And I'm talking everything. How many different people will that person be seeing in the office? And how much information are they getting over everything about what they did during the surgery, what precautions they have, what things you need to do when you get home, and then the next day, and then for next week. And okay, well, now you got to go get your medication. You got to help for that. Well, you can't change the bandages until this day on this time. Oh, yes, you can't do this with the knee. You can't do that. You can't do blah, and you can't blah. You can't do this stuff. How much of that are you going to remember, or whomever is going to remember? Now, we just had the best case scenario that I made there, that the person has someone with them. What if they don't? What if they don't have somebody who is there with them to help them in that case, to remember all this stuff? And think about it. This person is coming out of surgery and and their mental status is all kind of questionable because they're on medication, and how you feel. Think about it. If you had your wisdom teeth pulled or you had a surgery, how you felt right afterwards. You don't feel great. You're not, you're not going to make the best decisions. You can't, make clear-headed decisions. You could argue if you signed a contract in that point and somebody tried to come back and hold you to that contract, you could say, look, I wasn't in sound mind. Yes, exactly. You probably wouldn't sign a contract in that state of mind. What do you think you're going to remember all of that stuff? Okay. Also, if you have family or friends or whomever, don't they also have lives and things that they have to take care of? Think about yourself. If you have a sick parent or somebody like that, how hard it is to balance your life, your family with work, and you try to go do all that. It's a huge amount of stress. Now, think about those other things that she brought up. Are they going to remember like precautions and stuff like that? Okay, I'm not going to call patients liars, but people don't fully understand. They can overestimate things. They can overestimate their abilities. That happens all the time. You could ask somebody, do you think you can go run a marathon in 6 months? And they'll probably be, oh yeah. And then they'll never train and they never do it. But think about that. What, will this fit through your door in your house? Oh, yeah, it probably looks like it. Yeah, it works. Is that how you build a house? Do you just eyeball it? No, you don't do that. You don't know all the aspects. And then that physician has not seen that person's house on what they actually have. So when you have a therapist coming to the home and working with them day one, they can ensure those things. Okay. Let's make sure that you understand the safety that's going on. Let's make sure that you are managing your medication correctly. Let's make sure that you're able to get it. Oh, do you need other services to possibly come in and help? Okay. I have the resources to contact them to get them here to help take care of you. Okay. And there is another thing that drives me absolutely bonkers that just gets missed with things like this. If 2 weeks is too long to wait for therapy, hit that like button and subscribe to the channel. Back to the video. The thing is, physiology. When does human physiology go out the window in cases like that? It is so it is unbelievable that physicians forget physiology. And I mean, what's going to happen to this person from the time of injury to surgery until they go back to the doctor? How much weaker are they going to get? How much muscle mass are they going to lose? How bad is their endurance or stamina going to go down with all of that? How about their balance and proprioception, coordination? All of that starts dropping. Okay. And when a therapist comes in to start working with them in some capacity, you can minimize that as much as possible. I have seen that in what I do. I do outpatient orthopedics, and I can't tell you the number of patients that have been sent to me who have a chronic pain, a pain they've been dealing with 5, 10, whatever number of years. These people have been super inactive for long periods of time. They may be overweight. They may have low muscle mass, low endurance, low strength. And it's no fault of them. I'm not blaming the patients whatsoever, because you know what? They actually said, hey, I want to go do something about this. And they go see a physician and they say, well, go to therapy. But I'm just going to write a prescription that says 2 times a week for 3 weeks. And that's all you get. And then when they go back, the physician goes, well, therapy's not working. What physiologic changes happen in 3 weeks off of just 2 times a week? So 6 visits? 6 visits, or maybe 12 visits. They come 3 times 4. In that little amount of time, how big of changes are you going to get in somebody? All right. Seriously, how much strength improvements are you going to get? How much decreases in pain? How much improvements in mobility or stamina are you actually going to get? Are they going to be significant? You can get some. I'm not saying there won't be any. There will be some, but are they even going to be significant? It seems like all physiology just goes out of their brain. They're like, nope, it didn't work. We're going to do this thing. No, it was not a long enough period of time to cause a physiologic change. And if you want proof of that, look at what people do as bodybuilders. Okay. Do you think honestly, a bodybuilder or an athlete or just some kid that starts going to the gym, do they go to the gym and in a week look like Arnold did back in the day, just ripped and shredded? Okay. Does that actually happen? Stop and actually think about that if you want to argue against it. People, and that's the fault that people will say, like, oh, you went to the gym, for 2 weeks and you didn't get abs and I guess it didn't work. No, it takes time to do it. How about this? If you argue against it, what about your job? With what you do, could somebody come in there, take an hour, okay, just watch you for an hour. They could do your job the same as you or even better, but just an hour. A job that you may have worked for 15 years. You would argue no. It's very much the same thing. There has not been a physiologic change that has went on in that short amount of time. And one last thing to wrap up. It seems like physicians at times, and I'm not throwing up shade at it, okay? This is just something that drives me nuts that we just need to change, okay? We really understand what happens with basic physiology, okay? But it seems like physicians will just pick and choose when rehab is like going to the gym, okay? And I'm going to say rehab can be very much similar to going to the gym. It's a different type of thing, but they kind of pick and choose. So somebody in that case who's very weak, very deconditioned and those things, they're going to think that rehab is this barbaric thing of they're going to compare it to like, there's some trainer who's barking and yelling at them to do all this stuff and push up. For some reason, rehab at that point, that's what they think it's like. Okay. That, oh my gosh, it's going to be too much. No, it's not. But then the other time when you've had that this person who's again, very deconditioned, chronic pain, all these other issues, that it's like, no. That's they think, well, rehab is like the gym that you gotta have to work out and you just gotta do this stuff. Why are you picking and choosing what it is like? Okay. We as therapists, we as physical therapists, occupational therapists, speech therapists, know what to do with patients. As Lisa had pointed out, an individual like that case, you're not going to have them up running and doing all sorts of crazy stuff in the beginning. No. You're going to do what they can. You're also taking into account those other factors, making sure that they are following their protocols, that they're following the safety, procedures and things they need to do. Make sure that they're getting their medication, make sure they're bathing, make sure the incision and all that is looking good. Taking care of that person in those early stages to get them better. That is what they are doing. On the other side, that person with chronic pain who's been dealing with it for a long time, who finally said, hey, I'm going to go to the doctor and I want them to do something. And they're going to send me to therapy and I'm going to start on this. That being an advocate to say, you've only gone for 3 weeks and you've only worked out for 1 hour at a time that you've been in there, that is not nearly enough. That is not how you get a change. And again, like it to do if you're a physician, okay? Can somebody brought this up one time. They were dealing with someone who was a physician who wanted to lose weight, and the physician kept saying, well, just tell me the hack. Just tell me the hack to be all skinny and fit. Okay. Can you just tell me the hack to be a doctor? Just tell me the hack that I can just go do the weekend and I can just have MD and do everything that you do. No, it's going to take time to learn stuff. The same thing happens. Remember the biology or the physiology, the basic physiology of how things work. So important. Why that gets lost, I don't know. And I will actually document that note in my notes. When I have issues like that and I know some physician, whomever is going to argue, I document this has not been a proper amount of time to cause a physiologic change. Can you argue with that when you document that you're not going to get a physiologic change in 2-3 sessions? Okay. If it did, wouldn't we be doing that? Oh my gosh. We would have huge wait lists and everybody would be happy and nobody would be coming in. Anyway, I've rambled on. Let me know. Have you dealt with this? Have you had physicians? And again, no shade, no hate to physicians. Do great things. Hey, we're all on the same team. Patient is in the middle. We are all on the same team, but we want you to understand our position. Understand our position in our role on the team. We understand your position and your role. It's important that you understand ours because we all have to work together. A team works together. But if you have dealt with this in the past, please let us know down in the comments. What do you say when you get that? Do you let them know? Does people change their mind? Do they actually start to understand? Anyway, if you enjoyed the video, hit that like button and subscribe to the channel. It doesn't cost you a copay. And until next time, take care of yourself. Take care of your patients. I'll see you then.